Hi guys! This video is all about hip osteoarthritis in runners and what you can do as a runner to help you continue running without aggravating your hip joint. For those of you who don't know me, my name is Maryke. I'm the physiotherapist from sportsinjuryphysio.com, where you can get online assessment as well as treatment for your injuries. If you want to know more about that, check out the description of this video for a link. Now, you may notice that I've got a very interesting background at the moment. I'm visiting my family in South Africa, and my niece has kindly allowed me to use her room. So it's a little bit more interesting than normal. But that's also why this video is recorded rather than a live stream. So apologies for that, but the internet connection is really poor. Good, so what am I going to cover in this video? We're going to look at the anatomy of the hip joint, what happens when you get osteoarthritis in the hip, and then I'm going to give you 3 main tips for runners with hip osteoarthritis, how you can prolong your running career and how you can keep it hopefully pain-free. And then lastly, I'll answer some of the questions that's come in through the Sports Injury Physio or Sports Injury group. If you're not part of that group, make sure you look in the description of this video. There's a link to the group and you can join it to ask questions about any of your injuries. Very well, so let's jump right in. So the anatomy of the hip joint. The hip joint is a synovial joint. What that means is we've got 2 bones coming together. For the hip, it's the top of the femur, the ball, fits into the socket, the acetabulum that's on your pelvis. And those 2 bones are covered in very, very smooth cartilage. I remember once reading that the surface of that is even more slippery than wet steel for sliding on it. So very smooth cartilage, and then they are joined together through a capsule. Think of the capsule it's made of like that thick, fibrous white stuff in meat. When you eat meat, the same as tendons and ligaments. And it's really thick and strong, and it surrounds this whole joint, keeping the bones together. That capsule is lined with a membrane called the synovial membrane. And those little cells produces your synovial fluid. Now, synovial fluid is very important to joints because all the nutrients that a joint absorbs floats in that, and it also helps to lubricate the joint and make it even more slippery. So the important thing to remember about joints is that you do not have arteries or veins going in and out of the joint. So where your muscles and your tendons get all their nutrients and oxygen and stuff from the blood, your joint actually needs movement to get this fluid in and out, and also get the nutrients in and out of the joint, so that joint space, but also in and out of the cartilage that surrounds the joint surfaces. So movement is extremely important for joints because it feeds it. So if you don't use a joint for a long period of time, you sit still in a chair that you can't move, you may notice that you're really stiff when you get up out of that chair. And it's because you've essentially kind of starved the joint for a little bit. You've not moved it, so the fluid couldn't change, and therefore it feels quite stiff. As soon as you start moving again, you're feeling better again. Good, so that's how the hip joint functions. Now, what happens when you've got osteoarthritis? Osteoarthritis is often referred to as normal wear and tear of a joint. I'm not entirely sure that's the correct term for it, and we may in the future, as we understand the condition a bit better, change our minds about it again, because what we see is genetics definitely plays a role in how much joints are affected by age. So for some people, they can already have osteoarthritis in all their joints nearly by the age of 52, whereas other people may get to 85 and only have mild changes in certain joints. If you've had a previous injury to a joint, like for instance, you sprained your knee or you torn meniscus or something in there, or a significant ligament injury, then that may predispose that joint to early osteoarthritis, so early wear and tear in that joint. So there was something else I wanted to say about that. Oh yes, and activities plays a big role as well. So repetitive, hard working the joints. So for instance, builders or people who does a lot of kneeling down, heavy work like that, they often have trouble with their knees because they tend to work the knees quite hard. But again, with that, genetics plays a big role, because in my patients that I treat, I've seen people do hard physical labor and not have any issues with their joints, and then others really just can't cope with it with their joints. So yes, genetics plays a big role with it. What happens with osteoarthritis or normal wear and tear is, remember now how the joint is formed. So the first thing you'll see is little cracks forming in the cartilage. Now, osteoarthritis is also graded from quite mild to severe. And in the milder cases, you will just see these little cracks. As it progresses, and if it gets worse, it doesn't have to get more than a mild stage osteoarthritis, by the way. Those cracks will become larger, and the cartilage can even wear away in certain parts of the joint so that the bone is more exposed. The bone underneath the cartilage can also become a little bit softer. Then if we look at the capsule that surrounds it, that capsule often becomes irritated because you get a low grade of inflammation in that joint as well. And the capsule thickens and it stiffens up. Now you can imagine if this thing that surrounds the bones, keeps them together, starts to stiffen up, that joint is going to lose some of its range of movement. So if we think of the hip joint, you may find that your one hip doesn't move as freely as the other hip. Now, don't get paranoid that you've got hip osteoarthritis if you see a discrepancy. Most people I treat and most people I see, even myself, you're not as flexible on one side versus the other. That is normal. We're talking about big changes in range of movement. Then the lining of that capsule, the synovium lining, is where the inflammation and things, a lot of it happens. And that causes it to produce a lot more synovial fluid and inflammatory chemicals. And that's why arthritic joints are often swollen. Now, with arthritis, you get active period where there's active inflammation, and then you get kind of dormant periods where you can have a joint that has arthritis in it, osteoarthritis in it, and you wouldn't even know it. There's no symptoms, no pain, no swelling, nothing like that. Until one day you sprain it, and then they do x-ray and they go, oh, you've got osteoarthritis in that joint. I want to caution you about that because so often I've seen that any patient of mine over the age of 60, sometimes even 50, if they go to the GP, the mechanism of injury they describe is a clear sports injury. So for instance, they've twisted suddenly on their knee or their hip, and then a pain started from that sudden moment. So it's a clear injuring movement. The first thing they do is an x-ray on the hip or the knee, and then they go, oh, you've got arthritis, that's why it's there. No, you likely have got some osteoarthritis there, but you've got an injury on top of that. So always, always, always go see a physiotherapist if you've got an injury mechanism like that, because it may just be that the arthritis has nothing to do with it, or it could have predisposed you to the injury, but you now have a sports injury that can get better. So often what I find is as soon as the patient's told they've got osteoarthritis in a joint, they think there's nothing that can be done. There's loads that can be done, so please go and seek advice. If the advice you're getting is just take pain medication, go find somebody else's advice, because there is activity modification and strength exercises and things you can do to get things better. Anyways, I am off the point now. Where was I? Let me just see. Okay, so yes, what I was going to say is with osteoarthritic joints, you can get joints with no symptoms in it. And that's pretty much most of us, because if you scan most of us over the age of 60, you will see some wear and tear in the joints, and that is absolutely normal. Then the second type, you will have a joint that's swollen, but it's not really painful. And it's just because that irritated capsule is now producing loads more fluid. And then the third type, you can get periods where that joint is really painful, really swollen, and it's got acute inflammation in it. And those periods can be quite tricky, because at that point, exercise often doesn't make that much of a difference. You first have to get the inflammation down. So it'll be very gentle things. It won't be strong strength exercise and things. And often those patients do well if you can combine anti-inflammatory with exercise or treatment and activity modification. But you have to work closely with the doctor, because you've got to understand what medications works best for you and is appropriate for that situation. What I find is if a patient is in that inflamed joint stage, even, so I'm thinking specifically of necks and things like that, it doesn't matter what hands-on therapy you do, you can get a little bit of pain relief for that lasts a tiny bit, but then it comes back because that acute inflammatory response is still going. The good news is I have not had a patient who hasn't recovered from that, but it can take 4 to 6 months sometimes for that stupid joint to change its mind and decide, okay, I'm happy now again. And often you can't even figure out why it's done it. So don't become despondent. Just go seek some advice from somebody who has more than just medication to offer. Okay, so that's basically what happens in your joint when you have osteoarthritis. Oh yes, and there's another bit that happens. You get little bony points that grows out at the edges of the joint called osteophytes. Now, that happens because the body's trying to stabilize this joint, but unfortunately, those osteophytes often becomes part of the problem because depending on which direction they point, if they point into the joint, they can cause pain when you compress on them. And that's why you can sometimes get a painful block to a joint movement because the osteophytes are now making contact with each other. Oh, my brain's gone. There was another thing about osteophytes I wanted to say. Anyways, it will come back to me in a minute. But yes, that's all the changes that happens with osteoarthritis. Now, as a runner, you've been told you've got some osteoarthritis in your hips. What should you do? First thing I want to say is there is absolutely no research out there to show that running causes osteoarthritis in the legs or in the hips or the knees. It's not necessarily bad for you, but that again is patient dependent and it depends on which part of the joint has osteoarthritis in it. So you can go according to symptoms. My first tip would be to maintain your flexibility. So remember, I've just said that that capsule becomes thickened that surrounds the joint. So it's more likely to restrict your range of movement. So you have got to become more and more diligent with doing flexibility exercises as you get older. Because remember, we all get a bit of wear and tear in our joints and all of our capsules become a little bit tighter. Now, what I will say is often people think that they should push through pain and just force movements, it will eventually go. No. Again, remember, there can be little osteophytes, there can be bones that's blocking your way, so never push into pain. And there may be certain movements that just won't come back. But start from today and maintain what you've got. That's the best thing you can do. And if you manage to get anything extra, perfect. So I want to run through a few movements with the hip for you because they are classic things that's usually painful when you have hip osteoarthritis. The other thing with stretches is you don't force them. You take them to where you can feel the first stretch sensation of a muscle stretching and you hold it there for a long period of time. Something that works, that may supplement the stretching very well is if you do movements that moves the joint through the range of movement. And I'll demonstrate some basic ones in a minute. Okay, so let me see if I can shift all of this back without letting anything collapse and get this camera right so we can have a look at some movements. Good. Oops, get the toys out of the way. Let's see, that should work. Okay, so the first and the easiest one is often when I see people with the hip osteoarthritis, the hip flexors or the front of the hip is quite tight. So when they try to take the hip backwards, there's not much range there. So one of my favorite things to do is you've got to hold on for this so you have good balance. So I tend to hold onto a wall or something solid and you just come into this position. Now, my mat that I'm on is nice and thick, so it's not hurting my knee. If it hurts your knee, place something underneath there. And all you want to do is you pull your tummy muscles in, so you don't allow your pelvis to come forwards when you do this. You have to pull it back. And then you just ease forward. So what we're looking for is a stretch over the front of the hip. And for me, it even stretches the inside of my groin. So you're easing forwards. Now, when you're in that position, watch out that you don't allow that to happen. Okay, you've got to pull your tummy in that you're there. And just hold that position. Now, if you want to make it more dynamic stretch, you can ease into it and then come back out. And ease into it and come back out. And that can often work better than just strong, sustained stretching. So test it a little bit and see what works for you. So that's a very nice way to get the front of the hip a little bit more flexible. If you work in an office and you find that sitting really tightens your hips up, you can do the same version in standing. So let me see if I'll fit in. Yep, that'll work. So you're just standing and you're doing that type of movement. So your heel can lift up because it's not a calf stretch, and you're just trying to get a stretch over the front of the hip. I know one of the people in the Facebook group asked about when she sat for a long period of time and she gets up, the front of her hip is really painful. That is a nice, easy type of stretch that you can do when you get up out of the chair, just some gentle kind of into lunge stretches to just get it moving a little bit again, but be gentle with it. And I would probably say, if you find that you're sitting for 2-3 hours at a time without really getting up, force yourself every half an hour to just get up and just move that joint. Because again, remember, you don't have arteries going into them. You need movement to get it fed. Second movement is we want to see how well it twists. So you'll find often that the twisting action in the hip is most restricted when people have a bit of arthritis in there. So the first one is, I think I'm going to show you this with me lying with my head towards you, because then you can see my legs better. Let me just see. Yes, that works. All you want to try and do is, can you get your foot on there? So if you're really stiff, I've seen people have to really struggle to get it there. Make sure you support your head. So place cushions under your head so you lift it up so you don't have to force it. And then in that position, you just push it out. So we're looking for that external rotation movement, that we get that going. You're not pushing as hard as you can. You're pushing very gently and you're just feeling a stretch around this bit. And it shouldn't be painful. It should just be comfortable. Sometimes it's enough to just get the leg there and not even push. And that's absolutely fine as well. Good, so that's for external rotation. Now, you will often find if you have a hip joint that's painful or that's got arthritis, it doesn't do well with squashing it. So you may find that stretches like this, or stretches where you bring it up into the pigeon pose, really hurts in the groin. When you're doing these type of stretches, you should be feeling it in your bum. You should not be feeling it in the groin. So if you're feeling it in the groin and it feels quite uncomfortable when you take out of there, it's not useful because you're just squashing the bones together and that's causing you pain. But if you can do it without pain, then you're welcome to do it. It's not bad for you. It's only if it causes discomfort in the groin when you do those crossing over movements. Okay, so that takes care of external rotation. But now, turning the knee in needs to be also flexible. And let me see if I can show you this from this angle. Very interesting angle. Yeah, that'll work. So you're lying on your front, your knees are bent up, and all you do is you let your legs drop out to the side. So that's a way that you can stretch that movement as well. And again, you can make it dynamic by just moving in and out of the position. There we go. And let me just think, what directions do we... Yes, that covers all 4 the main directions of flexibility. You can do any type of movements into those positions. There's no right or wrong. The main thing is you do not want pain when you're in the positions you're squashing towards. You want a stretchy sensation of muscles being stretched. That's for flexibility. So let me get this a little bit closer and then we'll talk about strength training. And I find these days, if I don't write things down, I forget. So let me just quickly log into this iPad. Oh, there we go. So the second one is to strengthen the muscles around your hip and your legs. People often think of joints as being, my knee joint isn't strong or my hip joint isn't strong. The interesting thing about that is joints are actually inherently extremely strong. The muscles that surround them are the things that become weak. Now, when you run, 60% of the forces that goes through your hip joint is meant to be absorbed by the muscles that surround the hip joint. So the main ones for that is your glute med, glute max, and all your deep gluteal muscles as well. So having strong, I'm going to call it a glute complex of muscles, will already take some strain off the joint for you. But don't forget about the other muscles in your leg, because your calf muscles need to be strong, that they can soften your landing and take some of the force out. Your quads need to absorb some of the force, as well as your hamstrings. So you really need to make sure that the whole leg stays strong. I'll put a link in the comments of this video, or if you're watching this on YouTube, in the description. But I like to go for all-in-one exercises. So things like glute bridges and doing single leg glute bridges, or doing sit to stand exercises, or I think they're called Bulgarian split squats, where your leg is on the back on a chair and you slowly go up and down. What I will say is, if you've got a joint that's iffy, it may not want to go through the full range of movement. So don't force things. One of the first exercises people tend to give for glutes are the clams. I find clams quite provocative for people who have certain types of hip osteoarthritis. So watch out, if you're doing the exercise, you should feel as if you've worked the muscle. You shouldn't be having an ache or discomfort for half an hour or even longer afterwards. So whatever exercise you do, it should be pain-free while you're doing it, only feel the muscle working, and you shouldn't pay for it later. Okay, so choose your exercises properly. And if you do an exercise and you think, oh, that's really painful now, don't just think that I can't strengthen. No, that exercise is just not right for you. So go see somebody who's got loads more ideas of different things that you can do, because there's always something you can do. You must maybe just restrict the range of movement or make it slightly easier for yourself at the beginning. But yes, I'll put a link in the description of this video to an article I wrote about glute strength and stuff, that you can have a look, because the exercises in that strengthens the glute med, glute max, as well as the other muscles in the legs. So they're quite nice all-in-one exercises. Then thirdly, we're looking at cross training. Think back to my explanation of how a joint looks. So a joint doesn't have arteries going in and out of them. They need movement to get the fluid and the nutrients and things in and out. When you run, you get loads of movement, but you've got impact as well. So the joint takes a little bit more strain with that. And that's absolutely fine, because that stimulates the cartilage and the bone and everything to grow. But if you've got arthritis in a joint, it may just mean that the capacity of that joint to cope with loads of impact is slightly reduced, and that joint may take longer to recover. Now, if you do cross training in the form of cycling or swimming or anything that's low impact, you're getting a lot of movement, so lots of feeding, getting rid of all the inflammatory stuff. You can recover really well, but without the impact. So you're not causing more damage in there or working that too hard. So what I find is, for my patients with arthritis, and even quite advanced arthritis, they find that they can run much better if they fit in cycling sessions or swimming sessions into their week as well. Some of them have to reduce the number of sessions they run in, but it's a very personal thing. Others can continue with running nearly as normal. Think about your terrain that you run on as well. So softer terrain may be better for you. Also, watch out for a lot of downhills, because downhills we tend to bang, 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 bang. So play with it and start really keeping an accurate log of not just how much training you do, but the terrain you train on. So we're looking at softness of terrain, we're looking at downhill running, uphill running. Look at what type of sessions it likes, because often if we do faster sessions or hill running sessions, we may tend to have better form, because you're forced to go on your toes a little bit more, so there's less impact. So it may be that you have to change from doing mostly long, slow slogs to adding a little bit more of that in to get your volume up, or your intensity up. Now, one of the questions that was specifically asked in the group was with regards to ultra running with mild hip osteoarthritis. So Dave, I would say everything pretty much applies that I've just spoken about. Work on your flexibility, work on your strength training, but then when you look at your training program, really go and log what your hip feels like when you do different things. And you may have to rethink the type of training you do, so that you, instead of doing loads and loads of very long runs, you get some of that fitness endurance through more high intensity stuff, but that's not high impact. But I don't know you, I don't know how your hip reacts, so take that with a pinch of salt and just see what applies to you. Let me see if I've answered everything there that you asked about. Strength and conditioning. Yep, that's it. And Liz, you asked about, okay, Liz gets sharp pain sometimes when she stands up from sitting, and also after walking about 2 kilometers. It's pain in the hip, in the top front of the thigh, and it hurts when she flexes her hip for walking. Any suggestions? I would say I would probably see somebody so that they can diagnose that hip pain for you, because it can be one of many things. The area where you're describing the pain is a common area for the hip joint to hurt, but you've also got your iliopsoas tendon running there, and you've also got a little bursa that sits there. And I'm just wondering, if you're telling me if it hurts when you lift your leg up, that usually means the muscle is working when you're lifting it up. So it's more likely, or very likely, to be linked to your iliopsoas tendon, that you may have a bit of a tendinopathy there. That said, I have seen in the past that quite a few of my patients who's got a bit of arthritis in the hip tend to also have a bit of tendinopathy in the iliopsoas tendon. So yes, I think you need to go see somebody that they just identify which one of those two things is the thing that really is causing you trouble, or is it all of the above. Then the second thing is with sitting. If you sit in quite a deep chair, you squash the front of the hip more. So it may help you if you don't sit in very deep chairs, or when you do sit, you place a cushion or something underneath your bum that your hips are higher than your knees. So you're slightly giving that hip a bit more space at the front. That can often be quite useful. Or get into the habit of, if you know you're going to sit for a while, jump up every now and again, just swing your leg a little bit, get the blood moving, get everything moving, and gently try those stretches I've shown you for the front of the hip, but be gentle, because if it is the tendon of the iliopsoas, then, or the bursa, it can make it worse. So just ease into it, feel what it feels like, check your response a few hours later. Is it more achy? Is it happier? See what it likes. Excellent. I'm so sorry that these are not live streams, but as always, if you've got any questions, ask them in the comments. I'll come back to them as they pop up as messages. You're welcome to message me as well, or email me. Happy with all of those. Good. Have a really good rest of the day. Take care. Bye.